Hey, care champions! Ever had a patient with back pain that shoots down the leg, worsens with movement, and disrupts daily function? You could be dealing with a herniated disc, a common spinal condition with a major impact on mobility, pain, and quality of life. Today we're breaking down the anatomy, causes, treatments, and nursing care that can help patients get back on their feet, literally. The spine is made up of 33 vertebrae, with intervertebral discs between them acting as shock absorbers. Each disc has two parts, the annulus fibrosus, which is the tough outer ring, and the nucleus pulposus, which is the soft gel-like center. When the annulus weakens or tears, the nucleus can bulge or herniate, pressing against spinal nerves or the spinal cord itself. This herniation leads to pain, inflammation, and neurological symptoms, commonly in the lumbar, specifically L4-L5 and L5-S1 or cervical spine. Symptoms to watch for include lumbar disc herniation, which presents as low back pain radiating down the leg, also known as sciatica. You may notice numbness, tingling, or weakness in the leg or foot, and difficulty walking or standing for long periods. Cervical disc herniation can cause neck pain radiating to shoulders, arms, or hands, and grip weakness or numbness in the fingers. Red flag symptoms to be aware of are the loss of bladder or bowel control, which could indicate possible cauda equina syndrome, and sudden paralysis or severe weakness. These symptoms necessitate an urgent surgical referral. Diagnostic evaluation. Let's dive into the essential steps. First, the physical exam. A straight leg raise can be positive in lumbar herniation, and a neurological assessment helps evaluate dermatomes and reflexes. Next, imaging studies. The MRI is the gold standard for evaluating disc and nerve root compression. For those unable to get an MRI, a CT scan or myelogram serves as an alternative. An X-ray is useful to rule out fractures or alignment issues. Now let's discuss medical and surgical management. For conservative treatment, options include NSAIDs or acetaminophen for pain, muscle relaxants for spasms, and corticosteroid injections, either epidural or oral. Physical therapy focusing on core strengthening and posture training is also crucial, along with activity modification and ergonomic support. When it comes to surgical options, a discectomy or microdiscectomy involves the removal of the herniated portion. A laminectomy is performed to decompress the spinal canal. For severe or recurrent cases, spinal fusion helps stabilize the spine. Nursing care and rehab support play a vital role. Nurses monitor pain levels, mobility, and neurological function. They assist with ambulation and positioning, using techniques like log rolling for spinal precautions. Early mobilization and participation in physical therapy are encouraged. Education on proper body mechanics, posture, weight management, smoking cessation, medication use, and signs of worsening symptoms is provided. Emotional support is also crucial, as chronic pain can lead to frustration and anxiety. Bottom line, spinal support starts with nurse-led care. Herniated discs can be life-altering, but with prompt care, education, and consistent follow-up, nurses help patients regain mobility, manage pain, and prevent recurrence. Have a rehab success story or back care tip? Drop it in the comments. Like, subscribe, and follow for more musculoskeletal care insights, aligned with your clinical excellence. And remember, reduce the pain, restore the function, empower the patient.